Now we'd like to discuss bone morphogenic protein. Bone morphogenic protein allows us to do bone grafting without the traditional sources of bone grafts as listed here, with taking bone from the ramus, chin, iliac crest, or posterior hip or tibia. They reduce the amount of patient discomfort. BMP works on the patient's own mesenchymal cells, introducing them as the form of osteoblasts forming new bone de novo. In this case, we show a radiolucency apical tooth number 7 after extraction. You see that there is a significant large defect, which is seen here. The traditional bone graft was done here, which was unsuccessful, leaving a large defect with a small island of bone. You can see here the radiographs show with 3D cone beam, a large defect was through and through the palate. The second after CT shows a complete reconstruction of the alveolus with the silhouette of the implant in position for surgical placement. Here you can see the alveolus as it presented prior to bone grafting with the bone morphogenic protein. The bone morphogenic protein is a protein that is mixed together and placed on collagen sponges, which are allowed to fully soak for 15 to 20 minutes prior to placement in the graft. Here you can see the bone morphogenic protein on the collagen sponge was layered over the alveolus of tooth number 7, and then the wound was closed primarily. As you can see, this is a post-operative view 1 week later. This shows the very nice soft tissue healing, and with some additional edema, which is normal. Here's the post-op showing a full restorations of tooth number 7, as well as new crowns on 6 and number 8 for a better aesthetic result. Second case shows a large posterior mandibular defect, saddle ridge deformity, which the patient was requesting to have implants placed. 3D image model was obtained, and the ridge was waxed up to represent an ideal ridge, and a titanium mesh was prefabricated prior to surgery to help reduce the amount of time it takes at the time of surgery to place these grafts. Here you see a post-op radiograph showing the titanium mesh in place, which is fixated using 2 small screws. Post-operatively, 4 to 6 months later, traditional implant therapy can then be instituted, and you can see with the final restorations in place how this has been restored very nicely. And clinically, you can see that the soft tissue and bone is healed very nicely posteriorly. This is what bone morphogenic protein allows us to do. Another application of bone morphogenic protein is reconstruction after maxillofacial trauma. This case pictured here shows a patient who fell and fractured her anterior maxilla as well as her dentition. With the fractures going through the dentition and the alveolus, they were unsuitable for final restoration. A cone beam scan was then used to create a 3D image model. This model allowed us to remove the dentition, place lab putty in the areas where bone grafts needed to be done prior to implant placement, and pre-bending of the titanium mesh that would hold the bone morphogenic protein. The scans also allowed us to virtually place the implants using the Nobel Guide software. Using the Nobel Guide, the implants were placed in the positions that are indicated by the cone beam software. And you can see the final restorations in place with excellent occlusion and very pleasing aesthetic result.